Karol. At this year's European Association of Urology Congress here in Barcelona, you are presenting new research on the effect of personality traits on the outcome of prostate cancer surgeries. Could you tell us a little bit on how the study was designed and what its main findings were?
Yeah. So, in the years from 2005 to 2010, we operated a bit under 1,000 patients for prostate cancer, localized prostate cancer. And then about 70% of the patients, that is more than 700 patients, answered a questionnaire on which called EPIC 26. So it's a PROM, a patient-reported outcome measures questionnaire, reflecting quality of life of the patients. And in addition, a short questionnaire on neuroticism, consisting of 6 questions only. And the main findings were that patients who were dichotomized as high neuroticism, they had significantly higher adverse effects or side effects after surgery. And the side effects were both bother, so how the side effects were perceived by the patient, as well as pure functional side effects. So we were looking at the so-called urinary domain, mainly continence, incontinence, bowel domain, the sexual domain, sexual function after radical prostatectomy, and hormonal domain. And on all domains, patients dichotomized as high neuroticism had worse functions and more bother. And the significance was about 20% worse, given in round numbers.
And that seems to me like quite a high number. What do those results now mean for the actual practice?
Yeah, so we don't know yet. We have to do the study maybe in another hospital, maybe a multi-institutional, and in other countries as well, just to repeat the results. That's the first point. And the second point, you asked, what does it mean for the patients? Well, hopefully we could give patients in the future a questionnaire on neuroticism. And neuroticism is affecting about, or high neuroticism, about 1 of 5 to 1 of 4. So 1/4 to 1/5 of a Western population has this feature, and hopefully we can pick out the patients who are at risk to have more bother and more poor functions after a radical prostatectomy. We don't know yet if we can affect the patients to have better outcomes, but we hope that we can in the future make, for instance, an intervention study to pick out those patients and give them a better psychosocial follow-up and try to help them, identify them. And that is important because neuroticism per se is a risk factor for developing depression. And we know that depression is quite severe for not so few patients after radical prostatectomy. So in certain series, about 15% of the patients, they will suffer from depression after radical treatment for prostate cancer. So that is both radical prostatectomy and, for instance, radiation treatment.
2 questions. Why is the number so high? Why do 1 in 5 or 1 in 4 patients have a neuroticism or a neurotic? First question. Second one, would those personality tests be executed before the surgery or straight after in order to better help patients?
So it's a good question. A personality trait is half of the patients, they have a genetic background, and half of the patients have this trait due to circumstantial things like when they are raised in the youth and so on. So we can't really tell. And the second question was?
When you mentioned the personality testing, would those be done, or ideally be done before the surgery?
Yeah, that's a good question. So a personality trait, that means that it is constant, right? So as a definition, the personality trait is quite constant throughout the life of a person, right? That is why it is a trait. So it shouldn't in principle change. But I mean, it's a good question. If it could change during the course of a disease, right? Probably not, but I think this research hasn't been done in cancer patients yet, but probably it's constant. And then I think the personality test should be done before the treatment, because then you can identify the patient before the treatment and try to affect the outcome already at an early stage before the treatment, and then you know who maybe to concentrate on, both before and during hospitalization, and then afterwards in the follow-up.
What is the general attitude towards the more psychological factors in patient care? Are they being taken care of adequately? Also in respect to, I believe that especially for tumor patients, the focus is so much on the medical and surgical possibilities that we now have. Maybe more research in the psychological side is necessary.
Yeah, I agree with you, and it's taken care of more and more, and we get more and more aware of the importance and of the psychosocial care of the patient. I mean, it's not only to do the surgery and thank you and goodbye. I mean, the patient has to be taken care of at the best level, and of course it takes time, but I think that at the end of the day, when doing this, the patient satisfaction will be better, and then hopefully you could speculate, of course, that it gets back better also regarding the financial outcome, because if the patient is more satisfied, probably and hopefully the patient wouldn't need that much care afterwards in all the years after a radical treatment.
Karol, thank you very much for giving us a glimpse into your very interesting research.
Thank you very much.